A mental health disorder characterized by persistently depressed mood or loss of interest in activities can cause significant impairment in daily life. This is Pukka Media. Press like, share and subscribe. I'm Denise Ushimwe. Addiction is a disease that affects your brain and behavior. When you are addicted to drugs, you can't resist the use of them, no matter how much harm the drugs may cause. Drug addiction isn't about just heroin, cocaine, or other illegal drugs. You can get addicted to alcohol, nicotine, painkillers, sleep and anti-anxiety medications, and other illegal substances. At first, you may choose to take a drug because you like the way it makes you feel. You may think you can control how much and how often you use it. But over time, drugs change how your brain works. Those physical changes can last a long time. They make you lose control and can lead you to damaging behaviors. Drug abuse is when you use legal or illegal substances in ways you shouldn't. You may take more than the regular dose of pills or use someone else's prescription. You may abuse drugs to feel good, to avoid stress, or avoid reality. But usually, you are able to change your unhealthy habits or stop using altogether. Addiction is when you can't stop, not when it puts your health in danger, not when it causes financial, emotional, and other problems for you or your loved ones. That habit to get and use drugs can fill up every minute of your day, even if you want to quit. Your brain is wired to you want it to repeat experiences that make you feel good. So, you are motivated to do them again and again. The drugs that may be addictive target your brain's reward system. They flood your brain with a chemical called dopamine. This triggers a feeling of intense pleasure. So, you may keep taking the drug to chase that high. Over time, your brain gets used to that extra dopamine. So, you may need to take more of the drugs to get that same good feeling. And the other things you enjoyed, like food and hanging out with family, may give you less pleasure. When you use drugs for a long time, it can cause changes in other brain chemical systems and circuits as well. They can hurt your judgment, decision making, memory, and ability to learn. Together, those brain changes can drive you to seek out and take drugs in ways that are beyond your control. Who is mostly likely to become addicted? Each person's body and brain is different. People also react differently to drugs. Some love the feelings the first time they try it and want more. Others hate it and never try it again. Not everyone who uses drugs become addicted, but it can happen to anyone and at any age. Some things may raise your chance of addiction, including family history. Your genes are responsible for about half of your odds. If your parents or siblings have problems with alcohol or drugs, you are more likely as well. Women and men are equally likely to become addicted. Early drug use. Children's brains are still growing, and drug use can change that. So, taking drugs at an early age may make you more likely to get addicted when you get older. Mental disorders. If you are depressed, have trouble paying attention, or worry constantly, you have a high chance of addiction. You may turn to drugs as a way to try to feel better. A history of trauma in your life also makes you more susceptible to addiction. Troubled relationships. If you grow up with family troubles and aren't close to your parents or siblings, it may raise your chance of addiction. You may have one or more of those warning signs. An tendency to use the drug every day or many times a day. You take more drugs than you want to and for longer than you thought you would. You always have the drugs with you and you buy even if you can't afford it. You keep using drugs even if it causes you trouble at work or makes you lash out at family and friends. You spend more time alone. You don't take care of yourself or care how you look. You steal, you lie, or you do dangerous things like driving while high or have unsafe sex. You spend most of your time getting, using, or recovering from the effect of the drug, and you feel sick when you try to quit. Symptoms of drug use can often be spotted if risk factors of drug use have been identified. Risk factors for drug use include easy availability of drugs, drug users in the family, friends who are drug users, an unhappy home life, and a mental illness. The first sign of drug use is often a change in behavior. The user may lose interest in activities and hobbies and spend more time with friends than at home. Another symptom of drug use is sweeping change and decreased performance at work or school. The symptoms of drug use may indicate another problem. However, it is important to talk to the individual directly to confirm what you are really seeing are the symptoms of drug use. Other signs and symptoms of drug use include smell of drugs on person and clothing, constant discussion of drugs, pressuring others to do drugs, frequent washing of clothes, showering, or spraying room deodorizer to remove drug smells, presence of drug paraphernalia like a pipe, bong, or rolling papers, changes in mood such as anxiety or depression, skin that is cool and is sweaty or hot and dry, and needing more money or unexplained expenses. While the above are signs and symptoms of drug use, the signs and symptoms of drug use tend to be more severe. Signs of drug abuse are more pronounced as the user now has an extreme urge to use the drug. The user is no longer experimenting with the drug, they now feel a need to use it. Symptoms and signs of drug abuse vary depending on the specific drug, but typically seen across all drugs in the exclusion of activities in order to use the drug. When the person no longer participates in anything but drug use, it is a clear sign of drug abuse. Further, decreased performance in work or school and a vast change in mood and sleep are also signs of drug abuse. Additional signs and symptoms of drug abuse include unusual bizarre behavior, abnormal vital signs like respiration, heart rate and blood pressure, confusion, chest or lung pain, nausea, vomiting, diarrhea, stomach pain. Diseases such as hepatitis B or C or HIV from needle sharing, frequent hangover and hiding drugs. The specific physical and psychological effects of drug use disorders tend to vary based on the particular substance involved. The general effect of addiction of any drug can be devastating. Psychologically, intoxication with or withdrawal from a substance can be caused everything from euphoria as with alcohol or inherent intoxication to paranoia with marijuana or steroid intoxication to severe depression or suicidal thoughts with cocaine or amphetamine withdrawal. In terms of effect on the body, intoxication with a drug can cause physical effects that range from marked sleepiness and slowed breathing, as with intoxication with heroin or sedative hypnotic drugs, to the rapid heart rate of cocaine intoxication, or the tremors to seizures of alcohol withdrawal. Various treatment methodologies are employed in the treatment of drug abuse and addiction issues. When admitted to a rehab facility, a treatment plan will be divided for the individual addict. Per the National Institute of Drug Abuse (NIDA), it is essential that treatment is tailored to the unique individual, as there is no finite treatment that will work for everyone. The individual's history of drug abuse, severity of abuse, physical and mental health, and personal traits should be taken into account when developing the treatment plan. Likewise, the plan should be iterated throughout the recovery process according to the individual's progress in treatment. Diagnosing a drug addiction does not solely depend on determining the physical manifestations of the drug addict. Instead, medical professionals use a series of both physical and behavioral diagnostic criteria to determine if you have an addiction. Those criteria include, but are not limited to, inability to cease using drugs, inability to meet family, work, or social obligations because of drug use, a great deal of time spent obtaining drugs, using them, and recovering from them. Withdrawal symptoms occur when the drug use is stopped. Physical tolerance to the effect of the drug have developed. Compulsive use of drugs, even when harmful consequences are recognized. A person does not have to meet all of those points to have an addiction. For example, some drugs do not create physical tolerance or withdrawal symptoms. Also, addiction does not always result in loss of employment, etc. Everyone's addiction will look slightly different. In some cases, long-term residential treatment for drug abuse is necessary for some to develop their readiness for reintegration into their daily lives. Drug addicts who have already attended a standard treatment program but have relapsed may respond better to the therapeutic communities. Those treatment centers often involve 6 to 12 months stay. They focus on helping addicts resocialize by developing socially productive lives while maintaining personal accountability.